Hi, this is Pam Johnson with another Resident Pearl presentation. Today's presentation is what am I missing on a non-contrast CT? So, as we all know, many patients are being imaged with a non-contrast CT, particularly in the emergency department, when they present with flank pain and there's a concern for renal calculus. It's a very good study for renal calculus, and but it's really important to recognize that this is a scan that should be reserved for patients with really high suspicion for a renal stone, real renal colic, which is colicky pain in the presence of hematuria. And it really should not be performed in patients with generalized abdominal pain that may be localized to the right or left side. The reason that this is gaining so much popularity is that it's a super fast scan. The patients don't even get oral contrast, they don't get IV contrast, they just get in the scanner and they're done. And I'm concerned that some physicians get a false sense of security that we've ruled out other important pathology when we do this non-contrast study, which is just not the case. You may pick up appendicitis, you may pick up some sort of enteritis or colitis on the scan, even without IV and oral contrast, but if there's a possibility of other pathology, particularly appendicitis or any kind of vascular abnormality, you really should be giving IV contrast and in some cases oral contrast. So let's go through some of the things that we miss on the non-contrast study just within the kidney alone. Okay, here's the first case. Patient came in with flank pain and we see a small stone in the right kidney. And if we stopped here, if this was the end of the study, we would say, well, the pain was caused by a small renal calculus. But in this case, what that is a phlebolith within a vascular malformation. So there's no way that you would be able to identify this without administration of IV contrast. Second patient, we see a peripherally calcified mass arising from the medial right kidney. That could be a cyst, but it's not because it's actually an aneurysm. Now, this is where the coronal multiplanar reconstruction is your friend. When you're on at night, always look at the coronal reconstruction on these cases, because look at this case. You can see that this aneurysm is coming off of the artery. It's not even arising from the kidney. So you shouldn't even suspect this is a cyst. You should be concerned that it's an aneurysm. But really, definitively, the diagnosis is made with IV contrast. We see this is a large enhancing aneurysm. Next case, kidney looks completely normal on the non-contrast scan. We give contrast, and there's a small renal cell carcinoma that you will not see without contrast. There are many patients whose renal cell carcinoma is identified incidentally, and a lot of these smaller lesions, they are not contour deforming. You will not see it on the non-contrast scan, but these are the ones that are amenable to nephron-sparing treatments and ablation, and we would like to make the diagnosis when they're small. So keep in mind, you will miss these without giving contrast. Here's another patient, normal-looking kidneys on the non-contrast scan. We give contrast, and we can see that the patient has pyelonephritis. So pyelonephritis is something that you often see in patients in the emergency department. It's one of the most common things to mimic a renal stone. Of course, it's a diagnosis that should be made by urinalysis, but occasionally we're making the diagnosis on CT. On the non-contrast CT, you may see a little stranding, you may see that the kidney is enlarged, but you may see absolutely nothing, and it's only after you give contrast and you see the bands of decreased enhancement that you can make the diagnosis of pyelonephritis. Again, I want to emphasize that you do not need CT to make the diagnosis, but in some cases, patients will be having abdominal pain, and this turns out to be the cause, and it wasn't initially suspected. Here's another patient with flank pain and hematuria. The kidneys look normal on the non-contrast scan. After we give contrast, we can see that the patient has a renal infarct. This is another entity that you will not identify without contrast administration. Okay, one more. This is a very interesting case. Here's a patient who's having flank pain, and there is a small stone in the right kidney, very tiny. And look at the right ureter on the top right image. The ureter is completely normal in caliber. On non-contrast CT, the patient has parapelvic cyst. That's not hydronephrosis. And so the assessment here is that there's a tiny non-obstructing stone within the kidney, no hydronephrosis. The patient was imaged with IV contrast not because of this, but because there was actually also a mass within the mesentery, and we wanted to characterize it further. And after we gave IV contrast, you can see differential enhancement of the right and left kidneys. The right kidney is delayed. Again, there's no hydronephrosis, but when we image the bladder, we can see that there's a mass at the right ureterovesical junction. In this case, this was a hematoma due to a recently passed stone, but really a great example underscoring the importance of IV contrast in identifying even mild cases of obstruction. So really the caveat is not that all patients need IV contrast, but in patients with a high suspicion for renal pathology with severe hematuria and colicky flank pain, and if there's no stone seen on the non-contrast CT, we have to remember that there are other entities that we may be missing.